Hi everyone, welcome to my YouTube channel, Support and Career Development for Nurses, and my talk today is teamwork and collaboration in nursing, a very important topic. It's aimed at students, newly registered nurses and nursing associates, helpful for assignment work on this topic or may give you some ideas for dissertations, and I'm looking at the impact of team working on patient outcomes and nurses' experiences with some good references for you. Do check out my YouTube channel, it's free to subscribe, and I hope you enjoyed the talk. So why is collaborative team working so important in nursing? What can you do to promote positive team working and collaboration? So the evidence base is clear. Effective teamwork has been linked to improved job satisfaction, improved patient satisfaction, decreased nurse turnover, and improved patient care outcomes. And I have chosen some key references. There's a lot more literature out there. Really, teamwork and incivility and effective team working papers have really come to the fore over the last 10 years. There's papers linked to student nurses, nurse education as well, but I've just picked on a few that I think you'll find interesting. Rafferty, Ball and Aiken in 2001. Are teamwork and professional autonomy compatible, and do they result in improved hospital care? And this study used a postal questionnaire that was sent to 10,022 staff nurses in 32 hospitals in England to explore the relationship between interdisciplinary teamwork and nurse autonomy on patient and nurse outcomes and nurse assessed quality of care. The study showed the value of teamwork and its association with a range of positive attributes. Nurses with higher teamwork scores were significantly more likely to be satisfied in their job. They planned to stay in their role and they had lower burnout scores. Higher teamwork scores were also associated with higher levels of nurse-assessed quality of care. They also exhibited higher levels of autonomy and were involved more in decision making. So the higher the teamwork scores, they felt more confident maybe in being able to become autonomous and to make those decisions. It gave them that confidence. Zaheer et al. In 2001 focused on acute care nurses' perceptions of leadership, teamwork, turnover intention and patient safety. And this was a mixed method study. And survey methods and semi-structured interviews were used. It included 185 nurses or non-physician healthcare professionals, and 15 nurses were also interviewed on top of the surveys. So study results showed that staff perceptions of senior leadership, teamwork and turnover intention were significantly associated with overall patient safety grades. They suggested that healthcare organisations foster collaboration and teamwork through workshops, more simulations across professions within degree programmes. And it is something that maybe we do need to look at more in nurse education and within our profession, especially for newly registered staff, of setting up more interdisciplinary and nursing midwifery based simulations where we look at team working. The impact of incivility and rudeness on teams has been looked at internationally by a renowned professor of management and author, Christine Porrath, and her TEDx talk from the University of Nevada is very good. It's short, I think it's about 15 to 20 minutes. Do nice people finish last or best? And also Christine Porrath has written widely on the subject of incivility and rudeness on teams, mainly in business management and for biotech teams. But transferable data to any organisation. And Christine conducted a poll of 800 workers and 80% said they lost time at work worrying about an incident of workplace hostility. 63% lost time trying to avoid this person. And people also don't remember as well, or they're not as attentive to information. Job satisfaction reduced, and there was reduced productivity. 66% of people cut back on their work effort. 80% took time off work worrying about what had happened, and 12% left their job. So really, the outcomes and findings of the impact of incivility, hostility, rudeness at work has massive implications for healthcare if staff are less attentive or are avoiding people when we have short staffing, which we obviously have in nursing currently. In the paper by Porath et al. 2015, The Effects of Incivility, she conducted 2 investigative studies on in a biotech firm, and they found that the more people perceived a colleague as civil, the more likely people would seek them out for support, and they saw them as a leader. And people who were civil were perceived as warm and competent. And thinking about all the leaders I've worked with in and out of nursing, there are leaders, and you may know some, where they are abrasive and quite detached from the team, and they see that as a sign of strength as a leader. Whereas this flips it on its head and actually says, no, people will seek out those that they think are a leader, that are warm and competent. In Christine's paper in 2018, Make Civility the Norm on Your Team, her research found that 98% of workers surveyed over a 20-year period had experienced rude behaviours, and 99% witnessed it. And there's a lot of research now around people witnessing incivility and how it impacts on them. So there's other really interesting papers in that area. The impact of incivility and rudeness on nursing, Cook and Bush 2021 paper is interesting. Not just how many, but who is on shift. So essentially not just as how many staff you've got, but actually who is on shift with you working in that team is important as well. Looking at the impact of workplace incivility and bullying on care delivery in nursing homes. And it links to Christine Porath's research, where workplace bullying impacted on productivity and work. And this paper, Cook and Baumbusch, included, it's an ethnographic research study, included observations and interviews with staff, and it concluded that power relations led some staff to refuse assistance from co-workers, and it dictated the extent to which care was provided by residential care aides. So it really affected the team dynamics and who people would go to and who was on that shift working with you, as the title reflects. And finally, linking to incivility and rudeness, a fantastic TEDx talk, TEDx Exeter, by Chris Turner, who is a UK consultant in emergency care. Again, a fairly short TED talk. When rudeness in teams turns deadly, and he talks through a case study and the shocking impact of rudeness, arguing that civility saves lives. And the case study links to a 4-year-old admitted to emergency department at 2 a.m. and how rudeness impacted on the team working. And Chris also mentions Riskin and Erez et al. Studies. These are fascinating. These are studies from medical teams, simulations from neonatal ICU, and these teams were invited by Riskin and Erez et al. To a simulated training workshop to treat sudden deterioration in a premature infant, and half of the group were exposed to rudeness during the simulation. And in the 2015 paper, they concluded that rudeness explained 12% variance in diagnostic and procedural performance. So the group that were exposed to rudeness functioned 12% less relating to their performance with that deteriorating patient. In 2017, again, talking about simulation in the same situation and group, also found adverse consequences for information and workload sharing, helping and communication. And all of these elements are essential for safe practice. So this topic area is something that will be hopefully researched a lot more in healthcare and in nursing. So what do teams need to function effectively? So the research shows that we need open, transparent communication across teams. Staff need to know why decisions and changes are being made. There needs to be mutual respect between team members. There needs to be an awareness of team members' knowledge and skills. Shared decision making, shared responsibility for problem solving and making decisions. And you can't have shared decision making without having mutual respect between team members. It makes sense. Leaders who listen, engage and act as good role models. And I would definitely concur with these elements of everything that I've experienced over the last 34 years. The teams that I've worked with that function effectively would have these elements. And if you're a student, maybe it's interesting to look at SMART goals relating to identifying and increasing your understanding of how teams work and what support workers can do, and the proficiencies and competencies from support worker to registered nurse, for example, because you'll be delegating in the future. So you could gain some really good SMART goals in relation to this area. What can you do to promote positive team working and collaboration? It's not just down to leaders or whoever's leading. Obviously, that has a massive impact, but we all have a role to play in positive team working. What can you do? So understanding local corporate roles and team structures. So when you first start in a role or you're a student, reviewing how the team structures work. What teams are there to navigate and to work? Who do you work with in teams? You've got allied health professionals, medical teams. You might have a leadership team, an education team. Looking at job descriptions and junior staff competencies and proficiencies is helpful when you're delegating. You can attend team meetings to gain insights into how teams work. Review communication structures across teams. Do they use a bleep system? Do they have a special referral system they use? Do you have to use paper or electronic patient records? You have education teams, human resource, clinical governance, safeguarding and medical teams. And the YouTube video I have out on differences between a support worker, assistant practitioner, nursing associate and registered nurse is helpful to look at an overview of the educational levels of these roles. I know in Scotland you don't have nursing associates. This is in May 2020, but there are assistant practitioners working with some employers in Scotland. So you may find this video helpful. And as I said, it's free to subscribe to my YouTube channel to gain access to these videos. Offering to support others and influence change is helpful to developing relationships with your peers, and you get to know people. So offering to support students, you can be a junior, you can be a new starter in an area, but you can still mentor and support junior staff or support workers. Obviously, when you first start your newly registered nurse or nursing associate, you can feel quite overwhelmed and you might need time to settle in, but you can share your passions and your experiences once you're settled, act as a link nurse, teach others, support recruitment events. I work as a recruitment lead, a divisional recruitment lead, and the newly registered nurses that offer are amazing. People don't want to listen to an old fogey like me. They want to hear the staff that are actually in the roles. So I'm always encouraging them to talk about how they've got on and the support they've received and why they've chosen that specialist area. I've got 2 YouTube videos on supporting influencing practice that are helpful. 5 ways to influence nursing practice and support others. Also helpful for developing your career portfolios and for when you're looking at personal statements, and quality improvement and service improvement projects for nurses are wonderful ways of building a team. Having a service improvement project where all levels of staff can become involved will help with effective team working, because you're getting to know your colleagues and you're working towards a sense of purpose and achieving that goal of improving a change and something in an area that you work. Communicating professionally and honestly, you need to have an effective team working, and you achieve much more by being civil. I've never shouted or lost my temper. I've been shouted at during my career. When I started in the 1980s, I nearly left nursing because I was shouted at by a mentor. We didn't call them practice supervisors then, but the next mentor I had was amazing, and I learned how not to treat people. And as I grew in confidence, because I was quite underconfident when I started, and the next time someone shouted, it hasn't happened often, but the next time someone shouted, I said, I'm not prepared to talk to you when you're shouting at me. And the person didn't realise how they were making me feel, and they actually snapped out of it and said, oh, I'm really sorry. If they hadn't, then I would have had to escalate and look at mediation potentially, because we have to work with people professionally and you have to learn how to assert yourself. If you're in a team, you are going to work with people that you don't necessarily like. Your personalities can clash. I am not everybody's cup of tea, and I understand that and acknowledge that. And some people I may choose not to socialise with, but we have to learn to be respectful and to be professional towards each other. And it may affect the whole team if two people are not getting on. And they may need to seek professional advice and mediate and resolve issues. All the literature I shared with you at the beginning shows the impact that that can have if there is a breakdown with just two people in a team. Promoting positive teamwork and dealing with conflict. If you do experience or witness incivility or bullying behaviour, now initially when I tried to address it myself and said, look, I'm not happy with the way you're talking to me, it was addressed, we moved on, they apologised. But if it continues or you don't feel that you've got the confidence to address it, and as students it can be difficult, because if your practice supervisor or someone else is in the team says something that you really upset you, you sometimes need to have somebody with you, a third party, to address the issue, and it might be somebody from university. And what's helpful is to document what happened, and then you can escalate it to a manager or a personal tutor, human resources, freedom to speak up guardian. So if you're newly registered or not, you could be an experienced nurse watching this video. There's always somebody you can escalate it to, and you've got union representatives as well that you can go and talk to. And then ideally you can mediate with the third party and resolve the issue and set future boundaries so you can work together in the future, rather than somebody leaving work, because we know it impacts on the retention. And 12%, as Christine Porrath found in her research, 12% potentially may leave. So it's also important to share workload and seek support across a team, and never worry about asking for help, as workload should be shared and according to the skills and competence of staff. So I've got my delegating nursing care video that's helpful for you to look at. And if you've finished your caseload or your work, you should offer to help others who are struggling. And it was something when I was a nursing sister, I always used to say when we were delegating patients and allocating patients, that once we'd finished our washes and work in the morning or afternoon, that we went and asked the others in the team if they needed any other help. Use the team for advice, experienced nurses, line manager, clinical supervisor, educator, whoever you feel comfortable going to. Promoting team building and social events is really helpful. You can help support as a junior staff, and I know junior staff much better than me at arranging events. I'm in bed by 9 o'clock usually nowadays, but using those events to get to know staff and making sure you don't leave anybody out. You ask everybody, it's inclusive, because sometimes, especially if you've got international nurses, new starters, they might be quite shy or not know many people. It helps to build that team up. You have team building days where you might have a half day out or a lunch arranged, and there might be more formal team meetings in an area, and you should have minutes and agenda items so that staff that are on days off or on nights can still influence what's going on or have a say in what's going on. And debriefs, especially in areas like ICU, for example, or if there's been a deterioration or something's gone wrong in any arena of work, debriefs are fantastic to reflect and learn from issues together as a team. And joining shared governance group or working parties to promote collaborative working, where you could have a whole all different levels of a team working together. Shared governance places staff at the centre of the decision-making process, and managers have more of a facilitative leadership role, I should say, as well. But I've seen some fantastic shared governance groups with healthcare assistants, for example, leading those groups and addressing issues that are important to them. So finally, what I've learned after 34 years of nursing: treat junior staff, cleaners, students, support workers with as much respect as your chief nurse. I know ward clerks that are now very senior, that started as a ward clerk, very senior nurses in the NHS, and everyone deserves respect. Make each conversation count, however short. Try to listen to, smile, welcome new starters or staff at the start of your shift. It sets the tone for that shift. Acknowledging the skills and needs of students and staff helps recruit and retain them, and we all have a responsibility to try and influence that effective team working to retain our staff. And you can still have constructive feedback in a professional manner. And don't spread gossip. It's one of my pet hates. If somebody's gossiping in a coffee room about somebody else out on the team, it's not conducive to effective team working, and they could be gossiping about you when you go out. So don't partake in gossip, and you just say you're not happy to listen to this and call it out. It's not acceptable. So I hope you found my talk helpful, and some of the references I'll just put up now so you can freeze the slides if you need the references. And resources. I hope you found them helpful, and do put any comments in the YouTube of how you found the talk, or you can DM me on Twitter or Instagram, and I've got a website as well. So I hope you found it helpful, and take care wherever you are.